Hello, and welcome to the Brave New Weed podcast. And now, here's your host, Joe Dolce.
Welcome to episode 52 of the Brave New Weed podcast. Matthew, I want to say hello to you today.
Joe, how you doing, man?
I'm very good. I've been using CBD, and I want to talk about that. And I want to also tell you that is the focus of this week's episode. Do you know that somebody told me, I'm not sure if this is true, that there are more Google searches for CBD than God right now?
Oh, I don't doubt it in the least.
This
at
is the new,
all.
This is the new John Lennon, right? The CBD is more popular than God and the Beatles.
I just got back from New York City, and at one point we were driving through the downtown, the Midtown area, and within a 2-block radius, I saw 3 like full-size or larger billboards in downtown New York for CBD products of various kinds.
So the problem is, of course, is what is this stuff? How do you use it? What's good? What's bad? How do you afford it? And that's what we're going to talk about on this episode today. So I'm very excited to bring that to the audience. But before we start, I want to say that this episode is brought to you by Medical Cannabis Mentor, which is an online education platform that Dr. June Chin, one of our guests today, and I created with the idea of bringing courses to medical professionals, dispensary workers, and patients. We think that one of the main problems with cannabis meds is no one knows how to use them. It's not just take 2 tokes and call me in the morning. So if you're interested in cannabis and you're interested in medical cannabis education, we really want you to check out medicalcannabismentor.com.
Hey, Joe, I got a question for you.
Yes, sir. Yes, sir.
Would we be able to extend for our listeners some sort of like discount for the Brave New Weed audience? Like maybe they could visit?
I was just going to say, if you write to us at hello@medicalcannabismentor.com or joe@medicalcannabis.com, we can offer group discounts and we can offer Brave New Weed listener discounts of a significant portion. Okay, we really want to get the material out. We want to get the word out. So we're really, really eager to get it out, really. And we will make it as available as we can.
Excellent.
Fiscally, okay? The other thing I want to do before we begin the CBD show, the CBD hour, maybe we'll call it, is make a pitch again for support on Patreon. You know, we've been getting some fantastic support lately. And the numbers have really gone up for that, which is fantastic. We are accepting some sponsorship, and I want all the listeners to know that the sponsors we choose, we select. We're not just accepting ads or sponsorships from everyone. We try to vet the companies, we talk to them ahead of time, and we try to make sure that they are as reliable and reputable as they possibly can be. But really the mainstay of how this thing keeps going is through listener support. And I and everyone I know has made the leap to supporting the programming that we think is valuable in the world, right? So I support NPR, the New York Times, a bunch of other media outlets, PBS, different podcasts that I really love. And it's essential because that's how we're getting by these days. This is not about big money anymore. It's very important that people who care about this sort of information help to support us with as little as $1 a month. So if you can, please go to Patreon on our website and consider giving us $1, $2, $5, whatever you can afford. And by the way, if you can't afford it, please ignore everything I just said and tune in for free. What you could do, however, final pitch, is send the podcast to somebody you really like. Encourage them to listen. Maybe they'll want to give us $1.
Folks who do want to become patrons of the show can do so very easily. You can visit bravenewweed.com where you can find a link to visit our Patreon page. Or if you want to just cut the crap and go straight to the source, you can go to patreon.com/bravenewweed to become a patron.
So as we mentioned, CBD is just everywhere. The world is awash in CBD. Here's another fact. In 2017, Google searches for CBD overcame Google searches for THC. That was a first, and that's very interesting. People are looking for a medicine product that helps them relieve just some of the daily problems of our lives, the three main ones being pain, insomnia, and stress. And there is evidence that CBD works for a good portion of people, but you've got to know how to use it. You've got to know what to buy. It's also, if you keep buying CBD, a bottle of CBD, not even knowing what's in it, it can be very expensive. My calculations are that it could cost about the same as a leased car per month, about $300 per month. And that's a lot of money to be spending. So our first guest is Martin Lee. Martin founded Project CBD a very long time ago, before anybody had any idea of what CBD was in the early 2000s, and has continued like a real warrior, producing high quality information, getting the finest research, and really trying to separate the wheat from the chaff on this. And he's been doing it for a long, long time. So I'm really happy that he was able to join us. And the second part of our episode is with Dr. Chin, as mentioned. I always want to make sure that if we're talking about things like CBD, we can be as practical as possible and bring you guys information that is hard to get and hard to understand unless it's broken down really simply. And June is fantastic at that. So she's going to give us the practical guide as to what to buy, how to use it, what to look for as well. All right, I think between the two of these, you're going to have a great episode on the 411 of CBD. Before we begin that, let's talk about some of the latest occurrences of the day. Matthew, what news have you been following lately?
Well, obviously the biggest news that's floating around right now is a deal has come to light that one of the largest cannabis companies in Canada, that being Canopy Growth, has made a pitch and has worked through the legal red tape, and they are going to buy, well, a lot of the news is stating that Canopy Growth is buying Acreage Holdings, which is the infamous John Boehner related holding company in the United States. That's not exactly accurate. Canopy Growth cannot actually buy Acreage Holdings. Because if the way that it works out in the law, because marijuana is still illegal in the United States, if they get involved in any sort of illegal business, they'll actually be delisted from the Canadian Stock Exchange, and that would trigger them being delisted from the United States Stock Exchange, and it would probably crush the company. So what they've done is they are buying a warrant to secure the rights to buy Acreage Holdings if and when cannabis ever becomes legal in the United States. This has already impacted their stock. The Canopy Growth stock is up today, although people are cautioning, don't put all your eggs in this basket just yet. However, the deal is looking to be worth about $3.4 billion. Should the United States ever actually legalize cannabis, then Canopy Growth will spend that amount and own Acreage Holdings. And I think that would make them the largest cannabis company value-wise in the world.
Yes, I think it would as well. And it's, this is going to keep going on. I think this is the first of these sort of things. Consolidation is clearly going to be happening more and more as we go. But you were talking about some other interesting information coming out of Canada as well.
Yeah. So, we're about 6 months into blanket legalization in Canada for recreation. However, markets are showing that legal cannabis sales in Canada are still being wildly outpaced by the black market. This has to do with some supply chain issues of vendors and retailers running out of cannabis. Also, some odd structural function to the legality of how it is vended, to where customers can't interact with the plant before they've made their purchase. And
they can't see or smell it.
They can't see it. They can't smell it. They're buying off of a printed off piece of paper that just explains, lab results and
because you get it through the mail in Canada. In most cases, I mean, they are starting a dispensary system, so that certain provinces are, so that will change. But primarily, you get it either from your LP or through the mail. So you don't have a lot of it's hard to think about buying cannabis without smelling it or seeing it, frankly.
Right. Obviously, Justin Trudeau and the government was well aware that they wouldn't eliminate the black market immediately. And there's a lot of talk about comparisons to Colorado, which took about 2 years for the Colorado legal market to lapse the black market. But right now, cannabis
Don't you
sales.
remember?
Go ahead.
Don't you remember we talked to Rich Battenberg
Yes.
a couple of weeks ago, the investor from Colorado, and he
Yes.
said this is the way it always goes. Like the minute legalization occurs, there is an inevitable shortage. Production isn't up to speed, so you always know that. And then a couple of years after legalization occurs and production is up to speed, the market moves from flower into oils and concentrates. That's the recreational growth pattern right now. And that's the same for a state as well as for a country because they're both bordered essentially, right?
Mm-hmm.
So I think that was a good insight, and I think that's what everybody can expect to happen everywhere legalization occurs. Getting up to production just takes time.
Yeah, I think so. Well, and it's infrastructure issues, right? It's getting the product to the shelves. It's getting the product to the customers. All these things take time to get the kinks worked out. Currently, Canada's average cannabis sales are about $5 billion, and about $2 billion of that is made up of legal sales. So that leaves about a $3 billion black and also this gray market that Canada has, which are these illegal stores that are, selling a $50 cup of tea that comes with an edible because it's not legal to sell edibles or hashish yet, according to the law. However, the phase 2 of the Canadian law comes out in October, and that will legalize edibles and drinkables, and that may see, again, this sort of sea change of consumable legal products pulling people away from the black and gray markets.
Definitely. That's what's going to happen. There's no doubt. I think we've seen that again and everywhere else. Hey, I want to tell you about something else I heard. I want to follow up on the news story we did last episode about why New York failed.
Right.
This is going to be an ongoing bit of things ongoing bit of reporting, I should say. But I was told by an excellent source recently that another reason why it failed was that as a lot of the activists who were proclaiming legalization a de facto accomplishment were sort of congratulating themselves, our friend Kevin Sabet at Project SAM was out there doing some very active and very aggressive work. He was meeting and holding town hall meetings and inviting the media in with 3 groups, PTA groups, law enforcement, and healthcare professionals opposed to legalization. And what he was doing was ginning up a lot of fear. Oh, cannabis is going to get your kids addicted really quickly. Cannabis is going to make it impossible for law enforcement. There's going to be a lot more rise in crime. And healthcare, forget it. Everything is going to go down the toilet when people start using these woo-woo medicines.
None of which is statistically supported by anything.
None of which is supportive, but the media that he invited ate it up and caused enough fear that they were running in local papers, and the local assemblymen and senators and legislators got afraid. And as we all know, good old Andrew Cuomo has never been really that supportive of cannabis. I would say it's more like an anemic last-ditch support. And everybody got fearful, and they just decided, let's punt this down the line. However, I have learned also that this is probably going to come up again in the next month. So if you're a New Yorker, if you live in New York, you have until about June 19th to do the following. Call your legislators, call your assemblymen, your state senators, your congresspeople, call everybody you can and make a stink. Tell them that you want legalization to go forward. You might want to connect with orgs like the Drug Policy Alliance or New York NORML or a Marijuana Policy Project.
Doctors for Cannabis Reform.
Who are a LEAP, Law Enforcement Against Prohibition. Yes, who are supporting legalization in New York. Do your part. Pick up the phone. Write an email, write a note. It does matter.
Send an email a day if you have that kind of time. Like, pester the hell out of them, because that's the way shit gets done. If you have time to make a 5-minute phone call a day and you really care about this issue, be calling them up, man. Just bang those phones and make your voice heard. That's how the system's supposed to work.
That's how Kevin Sabet did it to bump this issue, that everybody thought was a fait accompli, okay? He got out there, he made noise, and people listened to him. So prohibition is not over, folks. Let's get into our episode.
Absolutely. Listeners, you can join the conversation with Brave New Weed today by visiting us on any of our social media platforms. Facebook, Instagram, and Twitter, all at Brave New Weed, will bring you to a place where you can like, comment, share the show, interact with other listeners, and keep the conversation going. Together, we are the world of Brave New Weed.
Martin Lee is the co-founder and director of Project CBD, which is an educational platform that focuses on cannabis science and therapeutics. He's the author of several books, including Smoke Signals, which is a social history of marijuana, and he's the winner of the American Botanical Council's James Duke Award for Excellence in Botanical Literature. He's also the winner of the Emerald Cup 2016 Lifetime Achievement Award. Martin has been studying cannabis. He's been studying CBD for almost 2 decades now, and it's a great pleasure to have him on the show. He spoke to us from his perch near Santa Rosa, California, actually in Healdsburg, California. Welcome, Martin Lee. So, Martin, thanks for joining us today. It's great to have you here. I know you're a busy man. Just to give the listeners a little bit of context, will you explain how Project CBD began and how long ago it began? Because it began a long time before people were talking about CBD every day, that's for sure.
Project CBD was launched in 2010, about 6 months after the beginning of a rediscovery of what we call CBD-rich cannabis strains in Northern California. Going back a little bit, you had a nascent cannabis industry that was going through a lot of ups and downs in California, largely because of law enforcement repression episodically. But somehow or another, since 1996, when the law was passed that legalized cannabis for therapeutic use in California, things were going along, and the medical marijuana phenomenon managed to survive, and not just survive, but in some ways thrive despite the police repression. So different industries were emerging, or niche companies were emerging to service this nascent industry, including analytical labs that were starting to test the cannabis strains to say how much THC was in them. Basically, that was the orientation. And as a result of those efforts, a number of CBD-rich strains were discovered, and we were party to that because we had learned about CBD from covering the science and the developments within the scientific community, which there already had been some focus on CBD going back a number of years. But that was all just among scientists. We learned about this. We carried that knowledge back to Northern California. And when the lab stumbled across a few strains that were, as we say CBD rich, we engaged the growers and told them that they had something potentially significant, because at that time, the medical marijuana phenomenon in Northern California and elsewhere was very much a THC-oriented phenomenon. And that's
very much so. I at one Emerald Cup, I met a guy. I believe he's deceased. I think his name was Ringo, who told me that he was one of the original growers of CBD and that he accidentally discovered it. In other words, he had been sort of growing and eliminating it because it was making his plants less powerful. And one day he sort of took some of this stuff up and tried it, and he realized that it had somehow soothed the pain in his back, and he got very curious about it. Is that mythology, or is that actually fact?
That's true. But Ringo wasn't. This is Lawrence Ringo you're referring to. He was.
Yes, exactly. Yeah.
There were a handful of horticulturists in Northern California who inadvertently stumbled upon these CBD-rich strains. Among the many they were working with, experimenting with, breeding, crossbreeding. There was so much interbreeding of these different cannabis strains that, and that the goal of the breeding basically was to create an even better high, something that would be, soothing and tasteful and delightful in a number of ways, but it was always oriented toward creating strains that would produce a really nice high. And the medical marijuana phenomenon grew out of that. That's just the facts. And it was, people discovered that these THC-rich plants were very, very helpful for nausea, for multiple sclerosis, for pain, for various things.
Yes.
The THC experience opened the door to medical marijuana in California. But the decisive change happened, a turning point really happened when CBD was rediscovered, because it was thought that the CBD was no longer as part of the genetics, and that it had been inadvertently sort of squeezed out, hybridized out, not because that was the intention of the horticulturists. It's just that's what inevitably happened as they were trying to boost the stony quality of their products, so basically it made the genes for CBD kind of recessive.
Yes.
But they were there. Imagine if all the plants are blue-eyed, but there's a few brown-eyed, genes sort of sitting recessively, and then you keep crossing, and lo and behold, you start popping brown-eyed plants, maybe the metaphor is better mixed if it was the blue eyes that were rare. But so the genetics were there, but they were hidden, and they just popped up inadvertently, and there was a number of people who had similar experiences that they were kind of a bit flustered by what they had created. They were concerned that it wouldn't take in the marketplace, that the places that they were bringing their cannabis to sell, the different dispensaries, again, they were looking for the great highs. And if they realized the plant didn't quite deliver in that way, they'd be skittish about taking it. But yet when they tried it themselves, they found a number of people said the same thing. It sure helped my back pain. It didn't get me as high, but it sure helped my back pain. So then you had about 6 or 7 different growers within a half year. This is starting in late 2009, going 2010 in Northern California, who had come upon these strains, that the nucleus that became Project CBD, approached each of these growers, told them about what we were hearing from the scientists when they gave CBD to mice, and how amazing that was, and the different kinds of animal models of various diseases, how they were being positively impacted in these experiments with CBD. So we knew a lot about what was going on with rats, but very little about what would happen with people. And at that time, we realized that this really could be a huge turning point for the whole medical marijuana world, because if these plants got out there, if these varietals, the CBD-rich varietals got out there and people started using them, then we would be able to find out if indeed the experiences were anything like it was for the mice. And if it was anything like that, we thought it was going to be huge, the therapeutic implications. But the other part of this was we also thought this could have major implications, the introduction of CBD or reintroduction of CBD into the medical marijuana experience in Northern California. It might be the straw that breaks the back of prohibition, is what we felt, because it would be very difficult for policymakers, for the drug warriors, to respond to the challenge of CBD, because it's not psychoactive like THC, yet very powerful medicine. It sort of removed the last excuse, it doesn't get you high.
Yes.
So we thought this could have major implications for what might transpire on a legal level, on a political and a social level, that in putting the CBD out there wasn't just a matter of finding out how people responded to it, but what would happen to the whole situation. And at that time in California, I should remind people, it wasn't. There was a lot of ups and downs. Obama was early in his presidency, and he was not a great friend to the medical marijuana movement early on. There was it was rather mercurial, the Obama administration. And it was sort of in the midst of one of those episodes of repression, where the landlords of the dispensaries were getting the letters telling them to shut down and so forth. This happened episodically in California.
Yes, all the time. So this is amazing when you hear this, because you guys were really visionary in being able to predict this. And here we are today. So what have we learned scientifically, evidentially, from 2010 to today about what CBD does? And that's a big question, so let's break it down.
Well, in the big meta level, what CBD does is disorder the cosmos, in the sense that it really has posed a challenge to the FDA, to the DEA, to the regulators, in that sense of how to deal with this. This is a hot potato. They don't know how to deal with this. And now, if we just go back to, I think, the original impetus of your question, what the therapeutic implications are. What does science validate about what we learned about CBD, or what I prefer to call full spectrum CBD experience? Yeah, we learned a lot, and I think part of it, you can break down the specifics and look at a particular condition and analyze the studies that have been done on mice and what scientists understand in terms of the molecular pathways of how CBD is conferring a particular effect, or how it's relating to other components of the plant. So whatever, scientists know a lot about this, but they've been limited in terms of clinical research. It can go to mice in their brains, but doesn't go much further. And that's because, that's an unfortunate situation. It's because of marijuana prohibition, because cannabis is illegal. Scientists have been able to work with the molecules in the plant, but not the whole plant in general. It's starting to change. It's a little easier in Europe. We're starting to see now some independent efforts undertaken by states that have legalized CBD, and most states have at this point. But yeah, but what's most significant ultimately, and you could break down a particular condition if you want to talk about it, is that the science behind CBD and cannabis in general has opened the door for understanding human physiology and biology in a very deep and profound way, in some ways unprecedented ways, and yet in ways that really validate sort of ancient conceptions of health. And we're beginning to confirm now what the Chinese knew 5,000 years ago, frankly.
Absolutely.
That's one of the great
absolutely.
ironies. And sort of, I think CBD is sort of really bewildering to a lot of people, even to myself included. I guess when we started out, we didn't expect that, the Coca-Cola was going to be eyeing CBD and put it in their products and things. I mean, the whole situation has exploded, so it's become a huge fad. Everything's got CBD in it. There's a lot of hype. There's a lot of, frankly, it's just a lot of it is sort of vacuous marketing, and yet there's something really going on with CBD.
No, it's absolutely true. I was in Colorado the other day, and I could get a coffee with CBD. I could get a coffee with turmeric and CBD. I could get anything with CBD, basically. Then you say, well, how much? How much are you putting in? Well, I don't know. We're putting in a dose. Well, what's a dose? I don't know. It's a dropper. So it does get frustrating, and it gets very difficult to sort of talk to people about it, I find, anyway. I'm sure you've had many years of frustration with it.
It really has peaked in the last year or so in terms of it going into like a mass cultural, well, I like to think it's going to be more substantial than a fad, but it has that quality now in part. And there's a lot of overblown excitement around CBD, but what it does, it seems to sort of magnifies the malaise of the culture, that the fact that so many people are reaching for CBD and seem to be pleased with some of the effects. A lot of it has to do with the sort of overriding anxiety in our society, that it really is in some ways unprecedented. And just all the desperation that people feel, the frustration with so-called conventional medicine, with pharmaceutical medications, just the incredible stress in society, with in terms of economic inequality, and in so many ways that it's almost CBD is the medicine for the modern age in that way. It also happens to be very diverse. Its implications, it can be at least the preclinical science, and actually we're hearing a lot of anecdotal reports at this point. CBD can be very effective for metabolic disorders, diabetes, and so you have the various classes of conditions, neurological, metabolic, cancer, et cetera, that seem to respond well to CBD, that CBD can offer in some ways. The challenge is figuring out what's real and what's not, and what you actually need to do to benefit from CBD. And I can suggest that, maybe not buying a water bottle with a little speck of CBD in there. It's CBD water. And these sorts of products are really, I can't see that they have much value. And yet there are products out there that can be very valuable and can be a health aid as well.
Let's talk about that. I mean, I have some some practical questions and some philosophical questions. But what are the practical? What are the practical products that one should use, and what is the dose of those products? If you are looking to begin using CBD, I know what I use. I know it works for me. But tell me the generals from your point of view.
It really is that I kind of always throw that question back to people. I mean, the two challenges are figuring out what you want to do and what you can access legally from where you are, because you'd have to answer that question very differently if you're in Kansas as compared to if you're in Oregon. In Oregon, you can walk into dispensaries and buy all kinds of CBD-rich products, and some of these are very good quality, and you can presumably you have a little more confidence that if there's information on a label, the fact that it's a regulated industry in Oregon, at least to some degree, that what's in there has to actually match the label. You feel a little more confident than if you're just buying from the internet or from a storefront in Kansas where they don't even allow any THC at all. So you're constrained by where you are and what you can access. Then you got to figure out, well, how are you going to approach this and what you're taking it for. And there's no universal answers. There's no universal dosages that are the right thing for everybody. The fact of the matter is every person within population groups there are variations on the genes that encode the enzymes that metabolize CBD and THC. So everybody will experience those compounds differently. And some people, for example, will just can't handle THC at all. They get very nervous and anxious, and they may have a genetic permutation, or you almost might call it a mutation, a polymorphism, so that the enzyme that would ordinarily break down THC doesn't work very well. So when they take it, they feel it has a much stronger effect, and they don't like it. And there's many variations on this, so you can't really say so easily what's right for everybody. What you can say is that the initial challenge in terms of cannabis therapeutics is managing psychoactivity, how you do that, and what are you comfortable with. And I think that there's been a kind of a misleading idea promoted by the CBD industry, which is that what makes CBD so great is that it doesn't get you high like THC, which is correct as a statement. But actually, what's so great about THC, it's a tool for managing psychoactivity. For some people, it means they don't want to feel stoned at all because they can't handle it. For many others, bring it on. And the fact of the matter is, when you have a mix of CBD and THC, you're likely to have a more profound therapeutic effect. So the more THC that one can handle, the better. And the gift of CBD is that it allows one, if they have access to different products and different ratios of CBD and THC, to manage that process, to include in their regimen as much THC as they can handle that they're comfortable with in combination with the CBD. And that's what CBD,
now,
in essence.
But many people, yes, and that's brilliant. I wrote this, is that they're sort of like THC and CBD are like Betty Davis and Joan Crawford. They fight each other, but they work together best, right? But a lot of people like to start with just CBD, and obviously people who live in places where THC in small quantities is not available are just using CBD products. So what should they look to buy?
Well, first off, let's say, are these things effective in general? And what we know from limited clinical studies, clinical trials with what basically just pure CBD that GW Pharmaceuticals has conducted, focusing on these catastrophic seizure disorders with kids. They were shown to work in clinical trials and approved by the FDA as a CBD pharmaceutical. It's basically a CBD isolate. Technically speaking, it's like 99% CBD and a tiny bit of a couple other things, but that's what it is. What they found is that when you look at the other alternative, and the alternative most people are going to be able to access, unless you're lucky enough to have health insurance then you can maybe access something like Epidiolex, this pure CBD. But for most people, that's not the case, and it's very, very expensive, and it's not going to be prescribed off-label because it's so expensive. That for those who can't access the pharmaceutically FDA-approved CBD,
which is $700
very,
a
very
month,
expensive,
I
like
believe, right?
over $30,000 for a year to do that therapy. But if you got it covered by insurance, that's great. Because frankly, the alternatives, the CBD extracts from hemp, which can also be made very pure and turned into an isolate or a distillate, and you can get that stuff out there. Well, when you compare the full spectrum, the CBD oils that include not just a lot of CBD and a little bit of everything else, or not just CBD alone, but the full spectrum of the extract from hemp or from cannabis, when you compare that to the isolate of CBD, we find that the CBD as part of the full spectrum has about a potency of 4 or 5 times more than the isolate. So you need a lot less. And it's just as actually the suggestion is it's more effective when you compare the data, because with an isolate it has a very narrow therapeutic window, and you need something akin to like a very exact dose and a very high dose. And if you go a little too high, a little too low, you don't get much of an effect, is what they're showing in animal studies when they compare the isolates to the oils. And then we're seeing an emerging set of data that shows that basically both approaches work. The full spectrum approach is more effective, better, safer. You need less drug interactions as a result, so forth and so on. So, okay, we're coming back to your question. Well, how does one sort out what they should get and what they should do with it? There's different. There is data based on what scientists are learning, doctors are learning, patients are learning. Part of it is data based on clinical trials, so you would think it'd be relatively reliable. And you can say certain things, for chronic pain. GW Pharmaceuticals found out that a tincture with 21 milligrams of both together, 21 milligrams of CBD, 21 milligrams of THC, that amount worked best for neuropathic pain in the research they did.
So let's talk about where I live, which is New York, which is a state of 25 million people, which is surrounded by many, many other states with many millions of people. And, you go into any store pretty much these days, any store, and there are 900 bottles of CBD on the shelves, mostly tinctures. And it's an incredibly confusing place to begin. So I say to people, first of all, look at the label. If it doesn't have milligrams or milliliters, it needs milligrams and milliliters. If it doesn't have that, it's probably a good idea not to buy it. Do you agree or disagree?
Well, the problem is that the federal authorities are making it very difficult for producers of hemp-derived CBD or cannabis-derived CBD products to market their products in a reasonable way. I mean, it's not clear that product makers are going to be allowed to put on the label how much CBD is in the product, or if they can mention CBD at all. All of this is up for grabs. You have a regulatory environment that's very confusing, at the risk of huge understatement. Very
understated, yes.
I mean, right now we have a situation where CBD is technically a Schedule 5 substance, Epidiolex. That's the lowest scheduling. It means very safe. And it's at the same time a Schedule 1 substance. So how a molecule can both be the safest and the most dangerous thing, that's a pretty interesting...
It's absolutely insane. Complete
well, it underscores that CBD really is amazing. It can be both.
Okay, but let's come back, because I get this question now 10 times a day. What should I buy? I mean, there's one company that I suggest people buy from. It's called Sun Soil. They post their lab results online. It's hemp derived. I know the growers. They're in Vermont, so I pretty much can vouch for them. But I'm sure there are a dozen similar companies like that. I don't happen to know them. And people are always saying, well, should I buy, if I can get cannabis derived, is it better than hemp? And what do you think? You're going to know better than I am. You're the expert.
Yeah.
Tell me.
In the overall sense, the distinction between cannabis-derived and hemp-derived is breaking down. At this point, it will become a moot point, because you have CBD-rich, high resin plants that have less than 0.3% THC.
Yes.
The growers or a handful of people have been working on this, and they've created these plants. And cannabis is very, adaptable to the human hand. And these plants have been bred to knock the THC level down slightly, but maintain the high levels of CBD. That's what's been growing in California, a plant that has a lot of CBD, but it had a little bit too much THC to qualify as hemp. It wouldn't get you high or anything like that, but great source of CBD if you want to extract oil. We call that hemp wink wink. And a lot of hemp wink wink has been growing in Colorado, Kentucky, Oregon, Vermont, and it's not really hemp. In that if you grew the plants to full maturity, it would be over the 0.3% THC cutoff line. It's an absurd line. It has no scientific basis. Right? But that's what the law says. The problem is we live in a situation where the regulators, the officials aren't meeting their obligations in terms of public health. I think their obligations in the case of CBD should be to craft policies and implement them that will promote wide and easy access to very safe, well-regulated products, the products that have been tested, that they can be sure that there's no solvent residues, that there's no pesticide residues, or at least something, not more than a certain amount, and that the labels are properly, what's properly indicated on the label, or what is indicated matches what's actually in the product. But instead, you have the authorities basically turning the other way and say, no, you have this huge explosion of commerce in CBD. You can get it, like you said, from your coffee shop or your gas station or wherever. And the government is basically saying, well, no, this is not really real because it's not a pharmaceutical, because it hasn't gone, all these products haven't gone through all the testing that GW Pharmaceuticals just went through. So by definition, these are not valid healing modalities, all the CBD you can get on the internet and so forth, because it hasn't gone through all the FDA's hoops. And this is just absurd. The whole phenomenon of CBD has underscored the inadequacy of that way of looking, of the way the FDA privileges pharmaceuticals over non-pharmaceutical approaches to health.
It's unquestionable and it's unconscionable from my point of view. I mean, I don't understand why we can't have an acceptable standard of botanical medicine in this country. I mean, the FDA does have a definition of botanical medicine. Why do they not apply it to a botanical product?
The FDA is not in the business of approving botanicals as medicines. It's in the business of approving pharmaceuticals, which are usually isolates or combination of isolates. And that's how the system's set up. It's not some big conspiracy. It's the way it works. The problem is, and I have nothing against people using pharmaceuticals to improve their health. That's what works. But the problem is, with respect to cannabinoids, the FDA privileges a certain approach to developing remedies and medicines from a plant that really is not the best way to approach it. I have no problem at all with single molecule CBD. It works according to science. But I do have a problem with privileging single molecules over full spectrum or a whole plant formulations. There's no science that says single molecule is better. That's a cultural, I should say that's a political and a financial thing.
And economic, yeah. Indeed.
And as far as we're concerned, I feel very generous toward pharmaceuticals based on cannabis. Great, bring it on.
Bring it on.
They can develop. But just remember that whatever happens there, and frankly, they've been trying to develop pharmaceuticals out of cannabis now for over 30 years, and all they got is single molecule THC and single molecule CBD. Not a particularly impressive performance, actually.
Not impressive. No, I think they should give up and start again, or give up, period. So listen, when you look at CBD, when you buy a capsule or take a tincture, the standard dose seems to be 20 milligrams. And I have looked and looked and looked and looked, and I can't find the evidence of 20 milligrams. Can you point me in the direction to show that?
No, I can't, because it doesn't exist. That was a sort of a hunch that people have gone on. Again, the problem, you can go and look at the pre-scientific literature, which is voluminous, and look at the amounts of CBD that scientists were giving to mice. when looking at an animal model of fill in your disease, multiple sclerosis or diabetes or whatever it might be. But the problem, you can't then say, oh, gee, they gave this much to a mouse, and a person weighs 100 times more than a mouse, so the person should take 100 times the dose.
Yeah.
Because mice metabolize CBD
Very
differently than people.
Yeah.
And in fact, if you did that, you'd be hugely overdosing. And even with kids, actually it turns out that little kids metabolize cannabinoids quicker, you might say, and therefore can handle higher doses proportionally than adults can. This is something that's counterintuitive because everybody's got the, oh my God, giving it to children. But
the Victorians knew that. It's been known since 1850.
So, but you're coming back to your question. I don't mean to be evasive. It takes trial and error. And there's a lot of a placebo effect going into things now. And, if a person feels they benefited from a CBD product, great, then keep doing it. But the pattern that we see oftentimes, and this is almost like an archetypical, right, of several passages. An epileptic will reach for CBD, pure CBD. They're not we're not talking about babies. We're talking about teenagers, people in their early 20s, a little bit older. Epilepsy can help many different kinds of, I should say CBD can help many different kinds of epilepsy, but it doesn't always work the same way as it does for these kids, where very high doses of pure CBD really do help.
Yeah.
So what happens is a person tries the CBD, the single molecule CBD, the isolates, and it helps them. It lowers the frequency of seizures. It takes the edge off. It gives them a clue it's going to happen. They can kind of do a little prevention, take a sublingual really quickly to kind of head it off, and it helps their life for a few weeks. And then it doesn't seem to work anymore. So then they take the next step. They go to a CBD-rich oil, a full-spectrum oil, not just an isolate, but something with a tiny bit of THC and a lot of other things in there, particularly terpenes. And wow, that even helps more than the isolate did. And they start using this, and they're going great with it. And for a few weeks, and then it seems to taper off again. And then they start experimenting. And then in a number of cases, what I've heard, it always ends up that they end up needing more THC than CBD in the oil. But when they find their ratio, when they find that sweet spot,
it works.
It works for them, and they stay there, and it works for a long time. And I would love to say, just go to this brand and take this amount, but it would be irresponsible to say it, and that's what the brands themselves are saying. They can market this stuff, and they have to market their products without being able to say what they're good for, which is an interesting obstacle that the cannabis industry has to deal with, because you can't make medical claims, and you can't, and it might be that you might not allow to even put CBD on the bottles, because right now we're in this interim period, and it's not clear how the FDA is going to regulate these things. We're in this odd position where now finally, at long last, it's legal to grow industrial hemp, now they're just calling it hemp. The 2018 Farm Bill dropped industrial.
Yes.
And they did that out of deference to CBD, because everyone knows that the reason why we can grow hemp in the United States, again, legally, is because of CBD, not because of, varnish from the seed oil of course. That's widely understood. But so that now it's legal to grow hemp for CBD if you have the right license and the state allows it. And it's whatever comes from the plant, as long as it's not greater than 0.3% THC, is also legal. So CBD is technically legal if it comes from a hemp plant grown in accordance with these rules, except at that point, anything goes, because it's not clear what it's legally able to be put into, made into. If you read the policy statements, it seems that maybe there's an opening for topicals, because the big bugaboo is all about ingesting things. In New York now, I think they passed an edict or something. They say they're going to not allow CBD in edible form, in foods, ingestibles. That means all these coffee shops are going to have to figure out how to deal with that. And I think the concern there, and I'm not sure, I don't agree with that approach to things, but there is a rightful concern about these products that people are going to be ingesting. They're not safety tested. There's no regulation. There's more regulation for producing kitty litter than it is to produce a CBD-rich product.
Absolutely no question. All right. So if you were emperor, what would you do?
What do you mean? What would I do?
How would you get this shit show
Well,
on board? How would you get it organized? What would things have to say? What would they need to do?
Well, first, you understand that CBD should not be denied to people, that it should be, you should encourage it to be made widely available and inexpensive, so a lot of people can afford it, because it's expensive for people
It's
that buy it.
ridiculously expensive. It's, upwards of $70 a bottle sometimes.
I can tell you anecdotally, or what I've heard from some doctors who are now prescribing to those who have health insurance, when their kids have epilepsy, they'll prescribe Epidiolex in order to cut the costs of what they're buying on the internet, so they can combine the pure CBD with the oil, and that means they have to the insurance is covering the Epidiolex, so then they can pay less for the oil. Because when they combine, that's what's going on today. It's so crazy. They found a use for CBD.
So, but you're the emperor. What do you want to do?
Well, I think you have regulations put in place to ensure that you have policies that encourage that those who are going to grow hemp do so not just organically, but using regenerative agricultural practices that actually make the soil better for growing plants, and that those farmers be subsidized and be favored in the marketplace, because that's in so many ways that will help things in terms of carbon neutrality and carbon capture and everything like that. But the main thing is you have reasonable standards of what's in the plant, so that when you extract oil, you can make sure that there aren't solvent residues, that there aren't undue pesticide residues, and these things can all be measured, and there should be reasonable ways of doing it. In California, the way they've regulated this stuff, it's a little bit crazy, because sometimes it's over-regulated and sometimes it's ridiculously under-regulated. You know that in California, it's legal to use nicotinoids on cannabis. These are this pesticides that's killing all the bees, that's been banned in Europe. Even the EPA says don't use this stuff, but California regulators, in their eternal wisdom, has said it's okay to use this stuff on cannabis. It makes no sense at all. And then in other things, they're also over-regulating it. They're making it impossible to farmers to function. So you need reasonable, sensible regulations. You need to start from square one, because we don't have data on what happens when pesticides are heated, burned, and inhaled, or solvent residues are heated, burned, and inhaled. The only reason you'd know that is from tobacco, and from what regulators know about tobacco crops, because there's a lot of pesticides that are used on it. But that data was never captured, never aggregated, never accumulated, because the tobacco industry stopped the research into this. And then the regulators said, okay, tobacco's bad, causes cancer anyway, so we don't need to know what happens when you add pesticides to the mix. So the regulators are really at a disadvantage, because they have no data on in terms of regulating something that they know is going to be heated and inhaled, and how these.
What should the label on a bottle of CBD say?
It should say exactly how much CBD and THC is in there per dose, and how much in total amount. If it is an isolate, a distillate, or a full spectrum, and it should also have some other indications of where you can. You should have a production number, so that if they know if there's a bad batch, they can recall it. These are just sensible things that you would do in any kind of
industry. Any industry.
Yeah. And these, you have labs now that you can do this, but because the industry is still operating on a semi-legal landscape with so much uncertainty, and there's also a lot of greed, and, there's big money involved, and everybody's going for it, people are liable to cut corners. I don't want to throw shade on the whole situation, but when you look under the hood, the problem is even for some of the big names of the oils that are out there, some of the national names, you look under the hood, it's not so great, and you find reports of big name companies claiming it's full spectrum when it's just an isolate in there, and vice versa. It's just a mess. But it's not rocket science to implement a regulatory program. But when has the U.S. government ever done good on regulations? They regulate so poorly everything, either under or overdoing it. Maybe because cannabis is such a dangerous drug, and CBD, who knows what it is, because it came from the evil weed, they'll actually regulate it properly, thinking they have to focus on regulation. And
three more questions. I have three more questions for you. Should people buy any CBD on the market currently?
Of course, people have to be smart shoppers. label readers. They should be willing to call the company and ask questions, ask to see lab tests. But remember, sometimes just because a lab test is posted on the website, that doesn't mean that's really what you're getting. It just means what's being posted.
Name 3 brands you'd recommend.
No, I'm not going to do that. I'm not going to do that. But
why? How come?
Because Project CBD has not gone and done lab tests in all these different brands. What we've done sort of random tests here and there. It's expensive to do lab tests, and that's not our mission. Yeah. And you can see there's dirty oil in there. We take one thing off the shelf, we test it, and it comes up a little dirty. Does that mean that it's going to be dirty in all the other? It's too weird. We don't need to get sued by companies. I can say with some confidence that there will be a pretty rigorous report that will come out from a very respectable source, independent source, that will provide an analysis of all the top brands and CBD hemp brands, and hopefully some of the brands in states where they don't have to rely just on hemp, like California and other places. And they'll do an assessment, and they'll provide the data, and they'll say which labels actually matched the content. And right now, there was a report within the last year, a very brief report published in the Journal of American Medical Association that indicated about 70% of the CBD products they tested were mislabeled as to CBD.
Yeah, I saw it. Everybody sees that.
But even there, when you really look at how what's 70%? Well, what's a permissible amount to be off? In terms of, is it 10% on either side of a reading? There's industry standards for this. You can just adjust that slightly. You get very different numbers. And I don't mean to undermine the implications. There are problems. There's no question about it. Fortunately, CBD in and of itself, THC in and of it are safe. As cannabis is safe. What the crap that ends up in there isn't safe. But if you read on the label that it got corn syrup, or different flavoring agents or coloring agents, that's a clue. Don't buy it, because you can get things without that stuff. So if you're looking at gummy bears, and most of the gummies are really crappy products that are basically melted down, these little toxic corn syrup blips, that they stick a little CBD isolate in there, they reformat it or reform it, and then they sell this gummy stuff, and it's really not good quality. When it comes to water and things like that, it's a great and coffee, and what do you need CBD in coffee for? You can't get it other way.
I don't know. I'm just telling you that's what I see. But listen, there's another thing, which is that there's been a rash of stories in the New York Times lately about sort of the snake oil quality of CBD. Do you view this as the last flush of prohibition? Why do you think this is currently, all the rage?
It's all the rage for many reasons. One is that CBD actually works in a lot of situations, and that there are products out there, that the full spectrum oils that can be.
No, I mean the bashing. Why is the bashing all the rage? Yes, you've read these pieces.
Yeah, but the bashing, I'm not sure if it's CBD or bashing the phenomenon. And the phenomenon is all about commercialization, corporatization. It's all about hype. It's all about desperation.
It's all about CBD. Nobody's talking about the corporations being bad players here. They're all saying we don't know anything about this plant.
Well, that's wrong.
It could be. It's clearly wrong. It could be snake oil. It doesn't have any efficacy. There's never been a clinical trial, which is all true. But clearly, there's efficacy. Clearly, people have been using it for thousands of years.
Yeah, it's not quite all true. There's a lot of preclinical science that happens to validate people's anecdotal accounts. There's not a lot of clinical research, and that's because of cannabis prohibition.
Of course.
And so you can't blame CBD for that. But when people learn how to use this and go through what they need to go through to figure out what works for them, and don't just assume, they just can go to anywhere and just buy some CBD and take it, and that's that. Well, it's not like, take 2 pills, call me in the morning. It doesn't work like that. It's an instrument, it's a tool, it's a gift, and people need to figure out how to make the most of it. That's the challenge. And CBD product marketer, the honest ones, are in a tough position. They all are, because they can't say what it's good for or really how to use it, because then they're violating federal policy. policies, medical claims, etc. So it's really up to us on the grassroots to figure that out, to share the information, to show what's working, and to continue with this great laboratory experiment in democracy called medical cannabis and CBD therapeutics that gets a bit derailed by all the hype, but it's still going on. There's something very, very serious underlying the whole CBD explosion that people are teeing off on. And you can make fun of it and say it's all snake oil, but really what they're showing is they don't understand this, and they don't understand that, in fact, CBD can be very helpful for many different conditions, and it works on many different ways, and it taps into how people function in a very deep way, biologically and physiologically, and that's for real. But it's a lot realer than a speck of CBD in a bottle of water. But it all comes together, and it really what it does is magnify not just the hopes people feel and the desperation, but just all the craziness in the culture now. They're talking $22 billion CBD industry by 2025 or something. All these things they're throwing around. So, but that says something that it just sort of brings out the symptoms of the sickness of the culture by that.
Yeah, it does. Listen, Martin, you're amazing, and that was a great interview. Tell people where they can learn about Project CBD, how they can subscribe to your newsletters. Tell the audience, please.
Project CBD is an educational platform on the web, projectcbd.org. There'll be a lot of information up there, useful information for people. We encourage people to visit, to interact, to get our free newsletter, and to be part of this sort of growing community, to share the information that they're experiencing if they have something negative or positive to say that might be useful for people to know. So that's how people can plug in, basically. And of course, then there's all the social media, Facebook and Instagram and whatnot as well. But the main thing is our website, which I'm happy to say has been undergoing a significant upgrade, and we're about to relaunch the whole thing, and we're excited about that. So
that's great. Thank you so much for joining us. I want to talk to you more and more and more, but let's stop this now, and we will continue at another time. Thank you, Martin Lee.
Thank you, Joe.
That was great. And it's really interesting to talk about the problems and the issues regarding CBD and the current state of an unregulated market. But as mentioned at the top of the hour, we do like to be practical here. We want to be able to bring a little more information to you guys about how you can use this stuff and how you can find it in a place that's that's accessible and that you can afford. So to that end, I want to bring on my partner in Medical Cannabis Mentor, Dr. June Chin. She's been a frequent guest on this show. She's a practicing cannabis physician in New York. She's treated over 10,000 patients in her career. She's really one of the first and one of the longest. And so I'm really happy to have June here, where we can talk about other issues of CBD and how you can get it and use it to your benefit. Welcome, June. June, thank you so much for joining today.
Thank you for having me.
Of course, it's always a pleasure. And I want to talk to you a little bit about some of the more practical aspects of using, buying, and understanding CBD based on your own experience with it. So you've used it for a number of years, correct? Personally.
Yes, I've used it for over a decade.
And you've probably treated how many patients with it, would you say?
I would say about 10,000 or more.
Okay, that's a lot of patients.
Yes.
I would say that makes you one of the most experienced providers in the world, probably, who's used it for so long. So there's a couple of things that are curious right now. First, let's just start with this. The New York Times a couple of weeks ago wrote a piece sort of saying, not comparing it to snake oil, but just saying, look, there's just not enough evidence to spend 2 pennies on this. What's your take on that?
Well, of course, they want to remain conservative because there's no double-blind studies, right? The gold standard studies. But which is interesting is CBD is really an empowering medicine. And CBD and cannabis is very unique because there is no precedent. There's no other drug in the world that we're using recreationally and medicinally for therapeutic uses. And equally important is that what CBD has allowed for patients to have is this community of support. there's people from all walks of life
Yeah.
that can help, give advice on this plant-based medicine. We can learn how to adjust it ourselves. This is true patient empowerment.
I love that you think that, because I think it's an unusual position for most doctors. I think most doctors would say, okay, keep trying it, but check back and check back. Is your take that CBD is because it's quite safe, really, and with very few side effects that I've ever noticed, is something that people can just use and adjust themselves? Yeah.
Yes, if they get a basis, like a 101 on how to use it and adjust for themselves, they can really take charge of their own health again. And, as practitioners, we can help facilitate and guide patients, help them learn how to figure out what their optimal therapeutic dose. And then it is experimenting on their own. They do take control of their health. It's not take one pill and you're expected to be done with. You're going to experiment. It's going to take 60, sometimes 90 days to figure out what works for you.
Yeah, as we know. So let's talk about the practicalities of CBD. I mean, the research you and I have both done together says that it works 50% of the time, or with at least half the people that try it. Is that your experience?
Yes, it works in most cases when there is a chronic inflammatory disease process going on, which is what most disease comes from.
And are there any types of diseases that we don't necessarily think of as inflammatory diseases that this applies to?
Well, just this morning, I saw a patient with chronic migraines. And when I said, this is a chronic inflammatory condition, she looked at me like I had two heads. And we started talking about, what exactly is a migraine? What triggers the migraine? Is it the stress? Is it the neck pain that you have? And we started to really dial down into it. And she realized, yes, these migraines are chronic inflammation, which is why the CBD has actually worked to prevent some of the migraines and to lessen the intensity and the frequency of the migraines that she's had.
Yes. Again, the research shows that CBD is as powerful an anti-inflammatory as cortisone. Is that correct?
Correct. Without the side effects, right? Cortisone suppresses your immune system. You can't take that long term.
What other kind of diseases or inflammatory diseases that we might not think about?
Fibromyalgia patients, irritable bowel syndrome, your arthritic patients, your lupus patients.
Interesting. Very interesting. So how do you begin to, one of the problems with CBD now is obviously the cost, right? Because people aren't thinking about it as a year-long medication. That you look at it, you buy a bottle, it's $60. That lasts you a week or 10 days. How do you advise patients to sort of mitigate the cost and find the right dose without going bankrupt?
Yeah, you're right. But when you look at what patients spend on alternative medicine, patients have to really think of cannabis, cannabinoids, CBD as alternative medicine. Mm-hmm. So when I talk to a patient, I think, well, what did you spend on massages? What did you spend on acupuncture? What did you spend on that weird thing that you found online that you're supposed to wrap around your back and it makes buzzing noises? Right? All these little tools you try and fix your chronic pain with. This is where you'll allocate to a plant-based medicine such as cannabis.
So I've been a huge advocate of one company that was formerly called Green Mountain CBD out of Vermont, which is now called Sun Soil. And they actually produce the cheapest, most verifiable CBD product that I have found from hemp. So it's mailable throughout the country. Do you advise patients to certain brands, or how do you advise them to what to even look for on the label?
Yes, that's a great brand that a lot of my patients use as well. The most important thing is, and Martin had mentioned that in your interview, is to look for third-party tested. That is really what we're going for. Of course, regulation has to play out. There's going to be some growing pains, but you still want to make sure that they're held accountable. You want to make sure that on their website, the vendor says that they have been third-party tested.
And if it hasn't, what are the possible concerns?
Possible concerns are solvents. The possible concerns are pesticides, or it could be diluted with other types of fillers. A lot of times, you might not find CBD in the product, but you might find other supplements like melatonin or valerian root. Those things are relaxing you. It's not really the CBD that's in it that's causing sedation or relaxation.
Yeah, this is one of the problems of an unregulated market, correct?
Right. But if we start to demand third-party testing, if we're actually being smart consumers and looking in the back of the label, like you do when you go food shopping, right? You look at the back of the label and see what that food product is made of. This is what you need to do with cannabis.
So let's talk about the label, because even the smartest people I know have a hard time remembering the difference between milligrams, mg, and milliliters, ml. And, when people say to me, I'll say to people, they'll say to me, oh, I've tried CBD, it didn't work. And I'll say, well, how much were you taking? And they'll say, I don't know, a dropper full. And then I'll say, well, how many milligrams were in that? And they'll say, I don't know. How do you talk to people about reading labels and knowing dosages?
Well, what's really great is in our educational platform, Medical Cannabis Mentor, we have a little bit of a dosing guide. And
Yes,
I usually refer patients to that as just a little downloadable thing they can keep on their phone. And it's just really getting used to converting how many milliliters each drop is, right?
Yeah.
And then how many milligrams in each milliliter.
Correct. So I find that very confusing, and I think other people do as well. So it seems to me that 20 or 25 milligrams seems to be a standard dose. Is that your observation after 10,000 patients?
Yes, I would say 20, 25 milligrams is good. And when you look in the back of the bottle and in the back of the label, it'll usually say 1 dropper full equals 10 milligrams, right? Yeah. That's for example. So then you take 2 dropper fulls to get 20 milligrams.
So what confuses me is that some patients, like I use 20 milligrams a day, twice a day, right, for pain. But some people are using tiny little doses, like 2 or 3 milligrams a day. Am I getting that wrong? I don't understand that. How could that be such a variance in dosage?
Well, a lot of it depends on our own metabolism and the bioavailability of the product. So let's say I have an irritable bowel disease and that messes up with my GI, my gut absorption. So I might not metabolize that cannabis the same way you metabolize it.
Got it. Yeah. Okay. So how do you? I mean, I know how to adjust a dose, but will you tell listeners, please, the simplest, easiest, most clear way that you advise people to adjust their doses? How do you start? Where do you go?
Again, there's a great dosing guide and titration schedule in our platform, but basically patients start low and they might start with that small dose for 3 or 4 days and then start increasing it for another 3 or 4 days. So their reaction to cannabis on day 1 might not be the same as their reaction on day 30. So you start to chart that, titrate up slowly, and keep track of how you're feeling.
And are you going to notice anything? I mean, one of the things about CBD that I find sort of mysterious is that you don't really notice it until it works.
So it is very subtle. You're right. It's very subtle. And with CBD, with cannabis, it's a cumulative effect. So patients might notice, on day 7 through 14, they're waking up a little less stiff. They're sort of jumping out of bed. They don't feel like they have to do their morning stretches as much. They don't feel like they have to warm up their body to get started throughout the day. What oftentimes I recommend for my patients is if you don't think it's working, you can try and stop after 30 days. And stop for a week or 2 and see if there's a difference. See if you feel worse.
Interesting. So it is really giving, I guess you're right, giving control back to the patient, saying, you have to listen to your body. You have to watch what's going on. You have to see how this is working.
Yes, absolutely.
Have you noticed any side effects in 10,000 patients over the years?
Yeah, CBD in particular, there's a good percentage. I would say between 5 to 10% of my patients will feel a little bit sedated. Some patients say they feel a little nauseous from the CBD, but these also tend to be the same patients that are sensitive to over-the-counter Tylenol, over-the-counter Advil, even some vitamin supplementation, zinc and vitamin C as well.
And we have also had a couple of people on the podcast over the year who say that it works really well when you mix it with other nutraceuticals or other compounds. Have you had any experience with that? For example, does CBD and melatonin work better for sleep? Does it amplify the effects of melatonin?
Yes, I do have patients that combine it with other natural supplements. I have herbalists and acupuncturists combine it with Chinese medicine.
Oh, really? Huh? And is that the idea that it amplifies the other meds? Is that what you think is happening? A synergistic sort of effect?
Yeah, I think it's complementary. It's integrative.
So other than Medical Cannabis Mentor, which we both own and work on, where do people find good, solid information about CBD?
Unfortunately, there's really no one good source to find good, solid information that's well referenced.
So really, they have to just do a lot of hunting, gathering, and pecking on their own, yeah?
Yeah, like they might be able to find some great articles on Leafly. They might be able to find some great articles on Project CBD, Martin's website. But there's really no one good source. The problem is that sometimes when you start Googling, it's like jumping through the rabbit hole and you really can get lost.
Yeah, someone told us that there are now more Google searches for CBD than for God. So that may be the case. But what I know for sure is that in 2017, there were more Google searches for CBD than THC, which does mark a huge sea change in what's going on in the world. Do you not agree?
I agree.
Great. Anything else you want to tell us about CBD, June?
I think that CBD in general, the medical cannabis movement really should be a wake-up call to the healthcare system. Patients are turning away from mainstream medicine and they're heading to the dispensaries because a lot of these dispensaries are giving them what they need. They're listening, they're connecting better with patients, they're teaching patients how to be in charge of their own health. There's no algorithm, for the perfect doctor-patient relationship. Medicine is so complicated, but using patients looking at plant-based medicine is really, really a wake-up call, I think, for the healthcare system in general for the U.S.
So pay attention, healthcare providers and policymakers. Dr. Chin, thank you very much for your advice.
You're very welcome.
As Joe and I continue to do the podcast, we're getting dozens of emails daily about new products or promotion opportunities that might be interesting. We're a pretty picky lot, so we don't pass them all along to you, but every now and then one merits our attention, and we'd like to be able to share it. If you would like to receive information like that, you can join our mailing list by visiting www.bravenewweed.com and signing up today. Joe, I'm really happy that we were able to have Dr. Chin back on the show. It's always a pleasure to hear from her, and I think she always shares with us amazing information. And it's a nice compare and contrast to what Martin had to say. And I think both of those conversations are equally important. The world of CBD out there right now is convoluted. There's no regulation. It's kind of like
it's insane.
It's snake oil salesman, right? You have a bunch of people out there who are just in it to try and turn a profit, and they don't care about the quality of their product, and they don't care about the potency or efficacy.
Some do. No, come on, some do.
But some do.
It's important. Yeah, it's important to parse between them, and I think this is the beginning effort of that.
Yeah.
Listen,
it's certainly buyer beware.
And it is. And this is, I just want to say one thing about regulation. Regulation gets a really bad rap thanks to years of Republican rhetoric. But it's really important. And it's really important in a new market like this because we are all swimming with sharks here, right? There's a million things coming at us. There's no one reliable source. So if we can help provide and help be that's a goal I would love to be able to work towards.
Absolutely. And we definitely don't want our listeners out there sinking, $200 or $300 into some olive oil infused CBD product that they've been sold that turns out to be just bunk and a waste of money and time. So,
yes, sir.
I'm happy that we can bring people this understanding and this research, and I hope it does help people become guided to quality products that are effective for their needs.
And again, listeners, if you think that's important and if you think this information is helping you, please think about supporting us one more time on Patreon. Thanks again for tuning in. We'll see you at the next episode.
Thanks, Joe. Great talking with you.
Thanks for listening to the Brave New Weed podcast. This episode and all future episodes are made possible by amazing listeners like yourself. If you like what you've heard, we encourage you to show your support by giving $1 a month for special access and rewards on patreon.com/bravenewweed. You can also follow us on Twitter and Instagram via @bravenewweed. Find us on Facebook at facebook.com/bravenewweed. And remember, you can always find more information about us or information discussed in each episode by pointing your favorite browser to bravenewweed.com.